Hello everyone. Today I'm here with my first video. So my first video is about NAFLD versus MAFLD. NAFLD stand for non-alcoholic fatty liver disease, whereas MAFLD stand for metabolic dysfunction associated fatty liver disease. MAFLD is a new term coined. MAFLD, a patient is diagnosed as having NAFLD when the imaging or liver histology shows hepatic steatosis, plus there must not be any other causes for hepatic steatosis like alcohol intake, viral hepatitis, or use of steroidogenic medications or monogenic hereditary disorder. So, when a patient is diagnosed as NAFLD, they understand that their disease is not caused by intake of alcohol. So they start to they continue to drink alcohol, which leads to deleterious effect. Secondly, they questions the doctor, that if their disease is not caused by alcohol intake, then what is the cause of their liver disease? So to answer all those questions and to make people understand what they are suffering from, a new term called MFLD was coined in 2020. So a patient can be classified as having MAFLD when the liver histopathology or the different biomarkers or imaging technique shows hepatic steatosis, plus there must be evidences which suggest that there is metabolic derangement. For this, out of for this there are three criteria, and out of these three criteria the patient must have one of those criteria. So talking about those three criteria, uh, one is that being obese, second is that if they are having normal weight or lean, or they are lean, they must have at least two of these criteria. And the third criteria is having diabetes mellitus. So in summary, I would say that when a person's have hepatic steatosis and out of this three out one of these one two three criteria, then they can be called as having MAFLD. So when a patient is described as having MAFLD, they understand that their disease is caused by metabolic dysfunction, so they start to have a good lifestyle. They think of exercise and decrease intake of the carbohydrate. So this has been helpful for the people to understand about the cause of their disease. Now is that the same? Now I would like to make people understand that NAFLD and MAFLD are not entirely the same disease. They are not synonymous, but there is overlap between these two conditions. So here we see that there is overlap between NAFLD and MAFLD. There is a separate group who has only an AFLD. There is a separate group which has only MAFLD. So the group who can only be diagnosed as NAFLD are those group of the people who have fatty liver disease, but they do not have the metabolic abnormalities or other etiology of the liver disease. Since they do not have the metabolic abnormalities, so they cannot be placed in the group of MAFLD. There is another subset of the people who can be diagnosed as having only MAFLD. They do not fall on the criteria of NAFLD, because these are the group of the people who have accumulations of fat in their liver. That is, they have hepatic steatosis, plus they also have the other etiologies like alcohol, viral hepatitis, or other liver diseases uh, in with them. And so they differ from the group who can be diagnosed as NAFLD. Thus we should understand that NAFLD and MAFLD are not always synonymous. And thus and this is my first video, and it would definitely help you to understand the differences between the NAFLD and MAFLD. And thank you so much.